Emiankwa Asante mantam no emu na Covid-19 ababeto dwasa Asante mantam mu no nipa Covid nam so de wato na nanom nsia do na watwe miensan no nipa 26 na akoka dadafo a enam Covid so nti won mato na nanom nsia do na wo hwe sede yare na ekosoro kro na kamantam ne mu eba fam na mum nipa ekum wo mu no na ekosoro pa wo de toto July bosomeda na etoso aduonu enum edeba enei August bosomeda etoso edu ensia na se nipa ewuo e wo Covid mu Asante mu no akosoro Regional Health Director Dr. Emmanuel Kojotenkran ene de nsemi etuja
Asante mu panyimpa wo hye apomode ho nsam so Dr. Emmanuel Kojotenkran nsemtwerefo nhyiemu a woyeye a wode kaikai omanfo efa Covid-19 yade no ho na wode tu dwase sesei efrikita wonsa bosomeda etoso adununum edibesi osanabosomeda etoso dunsia enipa na ahwere won kwa a no woye ahanu ene aduokono nso no sesei eko ahasa ene aduonum yensa okyerem se enipa adununsia na enam yade yiso ahwere won kwa okyerem se wose omanfo eda mo so no wodi hyehyeye a mpanifo de akwamu no eso esanse enu nko na bema yetimi aboye ho ban e de free Covid-19 ade no eho wode sansem wetu jawabra empanifo akoma mantemu ni mu Johnson & Johnson ahobambo panie empemeduonum ene ahanan.
So from 20th July up to 14th August we've recorded new cases of 392 new cases. From 20th July to 14th August. That gives us a total cumulative cases in Asante region since the onset of the pandemic as 19,622. Those who have recovered so far is 18,460. Unfortunately, we've lost 344. And our active cases as of today, it's 818 cases. You know the challenges that we've gone through to get you these vaccines. So we are hoping that at least the coverage will be 100% for the districts. The districts that are doing the vaccination were selected purposely because if you look at the trend in Ashanti, that is where we have the hotspots. So though we have cases in other areas, but we believe that when we vaccinate in these hotspots, it will help us to contain the outbreak better. So we've selected Asokwa, Kumasi Metro, Kwadaso, and Oforikrom, and that's where we've started the vaccination. We've been given 50,000 doses, and I believe that by Friday, we are very hopeful that we will give out all the 50,000 doses. I must assure you that plans are far ahead also to get us more vaccines. So as we get the vaccines, we will also make sure that we deliver it. And I believe that when we get involved with proper social mobilization, we can go ahead.